Hi, I'm Robin Avery. I'm one of the Transplant Oncology Infectious Disease faculty at Johns Hopkins, and I'm excited to talk to you today about our group, who we are and what we do, and our relationship to the ID Fellowship. So we are the Tucker Service. We're named in memory of Dr. Pamela Tucker, who was a wonderful, inspirational infectious disease physician at Hopkins some years ago who started this program and sadly passed away way too young. Our program was expanded by our immediate past director, Dr. Kieran Marr, and we are now comprised of 8 physician faculty, 1 terrific nurse practitioner, and a phenomenal research administrator director. And I'll tell you more about us in a moment. But first of all, I want to say that we really love working with you, infectious disease fellows. We enjoy having you on the clinical service. If you have a particular interest in doing research with us, we have a very large, vibrant transplant research center, which is combined infectious disease and transplant. And we have opportunities also for people to do a more transplant emphasis within their regular ID fellowship if you wish. However, I'm also very happy to say that whether or not you have a transplant interest, we feel that everyone graduates from our fellowship with a really excellent, thorough, deep, comprehensive fund of knowledge in transplant oncology ID and clinical experience, so that you can really, anywhere you go, if it incorporates care of those patients, you can feel very comfortable that you have a great foundation for taking care of them. Now, in terms of who we are, I'm Robin Avery. I've been here since 2012. Before that, I was at Cleveland Clinic for 19 years, where I had the honor of starting the Transplant ID program and also the Transplant ID Fellowship. My main interests are transplant-related viral infections, resistant CMV, COVID, strategies for safer living for immunocompromised people, and education of trainees and patients. Then we have my colleague Shmuel Shoham. Shmuel is an expert in fungal infections and respiratory infections. He recognized early on the need for randomized trials of convalescent plasma during the COVID pandemic, and he led some of those. He's also on the NCCN National Cancer Guidelines Committee, and he's well known to many people for disseminating TOID information on Twitter and podcast. I should say that TOID is Transplant Oncology Infectious Disease. That's our abbreviation. Then we have Christine Durand, who's one of our 3 of our faculty actually came up through our own Hopkins ID Fellowship, and they're all now leaders in the field. So Christine is one of the co-directors of our Transplant Research Center. Even as a fellow, she started an HIV and bone marrow transplant project, and she's become a world leader in HIV transplant, including leading the Hope in Action study of HIV positive to positive transplant, as well as hepatitis C transplant. She's also very, very involved in mentoring trainees who've gone on to do great things in the field. And then we have Veronica Diaverti. Veronica is our oncology and bone marrow transplant ID lead. She came to us after her transplant ID fellowship at Mayo Clinic. She's an expert on transplant-related viral infections, and particularly in the use of virus-specific T cells for treating severe infections like BK virus, hemorrhagic cystitis, and bone marrow transplant recipients. And we have Nate Permpelung. Nate came to us after his transplant ID fellowship at Duke. He's an expert in lung transplant infections, respiratory viruses, fungal infections, and COVID, and has done really interesting work on fungal infections after COVID and other viral infections. He's also passionate about teaching trainees clinical research methodology, including systematic review and meta-analysis techniques, and his trainees have published in top journals. And we have Olivia Cates. Olivia came to us after being the Chief ID Fellow at University of Washington. She's also a medical ethicist. She became famous initially for having led the earliest and one of the largest multi-center studies of COVID outcomes in SOT recipients. And as a medical ethicist, she also co-directs our core in ethics and qualitative research in the Transplant Research Center. And her interests include ethical issues in areas such as xenotransplantation. And we have Andrew Caraba, who was also one of our Hopkins ID fellows. He co-directs the basic and translational core part of the Transplant Research Center, and he's become a top virologist in initially HSV and then worked in CMV and later SARS-CoV-2, including collaborating closely with Bill Werbel on immunologic responses and neutralizing antibodies to COVID vaccines in transplant recipients. And then we have Bill Werbel, who is actually one of our most highly cited physician in the Division of Infectious Disease last year for his extensive work on COVID vaccine responses and organ transplant recipients. He's now the principal investigator of 2 NIH-funded multi-center trials to try to improve COVID vaccine responses. He's also very involved in HIV and hepatitis C transplant. And then we have Willa Cochran, who's a phenomenal nurse practitioner in transplant infectious disease. She came to us after an experienced years in HIV care and has really revolutionized our whole outpatient treatment program for high-risk patients, those living with HIV and hepatitis C. She, together with Shmuel Shoham, devised a quality initiative that has greatly reduced CMV in high-risk patients. But really during the COVID pandemic was when her leadership came to the fore. She devised and implemented a nurse-led, nurse-driven program for transplant recipients to get monoclonal antibodies as outpatients and now remdesivir. And thankfully that has worked so well that we've had actually one of the lowest mortalities in the world in our transplant program during COVID pandemic. And we have Darren Ostrander. Darren has a PhD in basic science, but fortunately for us, has turned his considerable talents to clinical research, administration, and direction. So he, together with Christine Durand, is one of the co-directors of the Transplant Research Center and oversees a very, very large, energetic, and talented group of researchers, research scientists, coordinators, database people, regulatory people, and so forth. So we think, a very exciting group. One of the things we really treasure is the fact that transplant oncology are a multidisciplinary field. So we work closely with all the transplant teams, the leukemia service, lymphoma service, solid tumor oncology services, microbiology, pharmacy, social workers, nurse coordinators, and so forth, all coming together to really help with the care of the patient. And as I mentioned, we love teaching. We love having you with us on the consult services. If you're particularly interested in TOID, we can arrange additional experiences for you in the outpatient arena, and certainly in the research arena. There are a lot of exciting projects that fellows can get involved with. But again, even if you do not want to do anything additional in that area, you will graduate from our ID fellowship with a terrific knowledge of TOID and ability to apply that anywhere that you might be. So thank you for listening. I wish you all the best with your careers. I look forward to meeting you, and I hope working with some of you. Thank you again. My email, if you have any questions for me, is ravery4@jhmi.edu. Thanks, and have a great day.